Hello, everyone. Thank you so much for joining us on this program focused on African women's health. This is a program that is dedicated to promotion of African women's health at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. In case you are joining us on this program for the very first time, my name is Dr. Olaide Ogushiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, if you have not forgotten, we rounded up our conversation on mental health by looking at suicide, and the plan for today is to start our conversation on maternal health. And I've got with me today Dr. Rakim Elmia of the School of Nursing and Midwifery, Western Sydney University. Thank you very much for coming, Rakim.
Thank you for having me, lady.
Thank you. Rakim is a registered midwife, and she'll be talking to us on the focus of our discussion today as we have some conversation on postpartum hemorrhage. But briefly, in terms of the conversation we are starting today, which is maternal health, this refers to the health of women during pregnancy, childbirth, and the postpartum period. While motherhood is often a positive and fulfilling experience for many women, for some it is associated with suffering, ill health, and even death. On a daily basis, according to World Health Organization, about 830 women die from preventable causes that are related to pregnancy and childbirth. And what is even concerning is that approximately 99% of this daily death is recorded in developing countries. And the major direct causes of maternal death has to do with hemorrhage, infection, high blood pressure. So straightforward, let's ask our guests this afternoon, Dr. Rakim Elmia, what is postpartum hemorrhage?
Thank you very much for having me again, lady.
Thank you.
That's a very important question, and it's exactly what you alluded to. Postpartum hemorrhage is an excessive amount of blood loss after childbirth, and more specifically, it's an amount equal to or more than 500 mils. Postpartum hemorrhage is one of the leading causes of maternal deaths in Australia and internationally. Unfortunately, internationally, in some of the developing countries, postpartum hemorrhage is unable to be prevented because they just don't have the facilities and medical equipment to be able to prevent postpartum hemorrhage. But in Australia, we are fortunate that we have the medical facilities to help prevent that. And it is estimated 5.8% of all births may result in a postpartum hemorrhage.
Thank you so much, Rakim. The situation you have presented actually sounds as life-threatening. Are there some causes or possible risk factors that our audience need to know?
So that's a very important question. There are several risk factors and causes that are attributable to postpartum hemorrhage, and among these risk factors include multiple pregnancies. So if a woman is pregnant with twins or triplets, it distends the uterus and puts the woman at risk of a postpartum hemorrhage. Other factors include high parity. So if a woman is pregnant with her fifth or a greater number of pregnancy, then that also increases her risk. An excessive amount of amniotic fluid, also known as polyhydramnios, puts the woman at risk. Some other things that we are able to minimise, but unfortunately we see an increase is in medical interventions, more specifically inductions of labour, where syntocinon is used to speed up the labour and increase the intensity and frequency of contractions, and also augmentation using an ARM or amniotomy, artificial rupture of membranes. Among some of the other things may include precipitous labour, so a fast labour and birth, or similarly prolonged labour and birth. Some of the causes include an atonic uterus, which accounts for 70% of postpartum hemorrhage cases among women. And that's where the uterus just fails to contract. So, and some of the causes for the uterus failing to contract could be retained products of conception. So either the placenta has been retained or some membranes have been retained, or if the woman has sustained some sort of trauma, so that needs suturing, so perineal, cervical, or even vaginal lacerations, or even an episiotomy. So the episiotomy and also lacerations do need to be sutured immediately if possible.
So generally speaking, is postpartum hemorrhage preventable?
Look, in some cases it can be preventable, particularly when I'm referring to the interventions. We can definitely decrease the amount of interventions that we expose women to. We've seen statistically that an increase in intervention equates to increased maternal complications and poorer outcomes. So it is important that we allow for women to birth naturally and for labour to progress naturally. And also increase skin-to-skin contact and breastfeeding, because as we know, with breastfeeding that releases oxytocin, and what oxytocin does is that it helps contract the uterus. So it is important to encourage early skin-to-skin contact immediately following childbirth, and also early breastfeeding. And if a woman does suspect that she is has an increased amount of bleeding, that she does seek medical assistance, either come into the emergency department if she's been discharged, or speak with her midwife if she is in a continuity of care model where a midwife has been her primary carer, or see her GP.
On this note, we're going to round off the program for today. And we're indeed grateful to you, Dr. Rakim Elmir of the School of Nursing and Midwifery, for coming to our program today. This is a nice way to round up the program. Next week, we're going to continue on the same big topic of maternal health. Please watch this video, share it, and let's together work together in promoting African women's health. And until next week when we meet again, it's bye for now.